Hello. So today we are going to be talking about factitious disorder imposed on another or Munchausen by proxy. We are going to look at the forensic implications and also a case study. Factitious disorder imposed on another, or FDIA, is a serious mental health condition in which a caregiver deliberately fabricates, exaggerates, or induces illness or injury in someone under their care, typically a child or a dependent adult. A defining feature of FDIA is the intentional deception involved in creating or misrepresenting symptoms. The victim is often portrayed to others as sick, impaired, or unable to function normally, despite otherwise being healthy. Unlike malingering, the perpetrator's behavior is not driven by external rewards such as money. Instead, the motivation is psychological, typically a need for attention, sympathy, control, or validation from others. FDIA is recognized within both clinical and legal frameworks as a severe, dangerous, and potentially lethal form of abuse directed at vulnerable individuals, including the elderly, but most commonly children. The actions undertaken by the perpetrator ranges from persistent lying about symptoms and falsifying medical histories to tampering with laboratory tests and actively inducing illness through poisoning, suffocation, or infection. The consequences for the victim can be catastrophic. The perpetrator causes severe abuse through poisoning, suffocation, and falsifying tests. They may also cause direct harm to the victim, causing chronic illness, disability, and even death. For victims of Munchausen by proxy, the significant harm to victims, including chronic illness, disability, and death, are often results from the abuse and unnecessary medical interventions. Siblings of identified victims may also be subjected to similar abuse or suffer unexplained illnesses or death. The perpetrator is very good at deceiving the medical system. They have the ability to garner support, manipulating medical and legal systems. This deception leads to unnecessary and harmful medical procedures. Um, Perpetrators appear caring, knowledgeable, exploiting trust they have gained from medical professionals. Deception makes detection, investigation, and prosecution difficult. Medical professionals unwittingly become a participant of the cycle of abuse. The role of the forensic psychologist is in the assessment of the perpetrator and the victim, credibility analysis, and expert testimony in court. As for the profile of a perpetrator, they are mostly female, often the victim's mother. They are medically knowledgeable. They have intense interactions with medical staff and are often demanding or overly friendly. They may shop around for doctors until they get the answer they want or the procedure that they want done. They are also unusually calm during crises and resist good news or the discharge of their child from the hospital. And the victim experiences profound psychological trauma due to the betrayal of their caregiver. There is often confusion about reality, their body, and health. There is also a high risk of PTSD, anxiety, and depression, as well as trust issues. Sadly, the victims may internalize the sick role to get attention. Long-term consequences might include permanent disability due to the prolonged poisoning and the danger of developing factitious disorder themselves. They may also struggle with relationships due to their inability to trust others. The impact on the victim includes physical harm. The victim endures unnecessary testing, surgeries, medications. Sometimes the victim is harmed through the direct abuse, like inducing infections, suffocation, and starvation. Consequences of these actions lead to organ damage, chronic pain, developmental delays, and death. The perpetrators often have a history of trauma or abuse, personality disorders, especially borderline personality disorder, narcissistic personality disorder. Poor self esteem is also common. The motivation for their actions is driven by a need for attention, sympathy, and control via the sick child role. For example, the mother finds purpose in caring for her sick child. The prognosis for the mother is generally poor due to denial and the tenacity of the personality disorders. Let's turn now to the case study, Lacey Spears. Lacey Spears is a 27-year-old woman who was convicted of murdering her 5-year-old son, Garnett, who died in 2015. Lacey was alleged to have deliberately poisoned Garnett with lethal amounts of sodium via his feeding tube over time. According to Lacey, when Garnett was a baby, he had severe ear infections. He wouldn't nurse and he couldn't keep baby food down. Garnett couldn't keep food down, so Lacey had a feeding tube put in after she told the doctors um, to put it in. Anyway, Lacey also had his throat closed shut. The reason? So that he couldn't vomit. At 10 weeks old, doctors found Garnett's sodium levels to be unusually high. So, hallmarks of FDIA include a long history of fabricated medical history for Garnett, extensive social media postings about Garnett's illnesses, seeking sympathy and attention. In fact, Lacey documented Garnett's life on social media platforms and on Garnett's Journey, which is a blog she created. Lacey also lied about Garnett's father and fabricated paternity. She tried to hide the feeding bag when the police searched her home, and the police found a container of salt in the bedroom. Lacey presented as a caring mother, but all along she was poisoning her son with lethal amounts of salt, making her son sick and eventually killing him. Lacey was charged with second-degree murder, depraved indifference, first-degree manslaughter. The depraved indifference charge focused on extreme recklessness, not necessarily intent to kill. During the investigation, the hospital found high levels of sodium in Garnett, which led to the involvement of police. When the police searched Lacey's home, they found feeding bags with high salt concentration. Other evidence included a social media trail and internet searches about salt poisoning. Lacey was found guilty of second-degree murder. In considering FDIA, the judge noted that Spears suffered from Munchausen's by proxy, considering it a mitigating factor in sentencing her 20 years to life instead of 25 to life max. In Lacey Spears' case, the prosecution's argument was strengthened by the discovery of a videotape showing Garnett becoming ill shortly after being taken to the bathroom by Lacey. This footage provided clear evidence that Lacey played a direct role in the illness of her 5-year-old son. Due to the sophistication of deception and manipulation involved, some FDIA factitious disorder cases are difficult to prove. Concrete evidence can be hard to obtain. For instance, Lacey moved to a different city once suspicions about her actions began to surface, making it harder to establish criminal intent versus psychological motivation. Systemic issues also contribute to the challenges of prosecuting FDIA cases. Medical professionals are often hesitant to suspect or report caregivers, especially when those caregivers appear knowledgeable, caring, and attentive. Their medical familiarity often works in their favor, shielding them from suspicion. Additionally, the lack of specific laws addressing medical child abuse complicates legal proceedings. Another critical question in such cases is how much weight a psychological diagnosis should carry in court. On March 2, 2015, Jurors found Lacey Spears guilty of second-degree murder. In Lacey Spears' case, her conviction and sentencing appeared appropriate given the circumstances. The judge took her diagnosis of FDIA into account during sentencing. Still, the tragic loss of Garnett at the hands of his own mother underscores the urgent need for increased awareness, vigilance, and collaboration among medical professionals, legal authorities, and social services to prevent similar tragedies in the future. Thank you.